Okay, well, I've got 1 o'clock. I will call the meeting to order. We'll call the roll. I'll have a few quick comments as housekeeping details. Sue will have a few comments with housekeeping details, and then we will turn it over to the department. We'll discuss, if you got the itinerary from Sue, we'll spend the bulk of our time on the department's presentation and followed by questions from the committee, brief discussion at the conclusion for future meeting dates, and we'll wrap it up by 2 o'clock, if not sooner. With that, we will have the roll call, please.
Thank you, Representative Moore. Senator Esp.
Here.
Senator McNally.
Here.
Senator Olszewski.
I'm here.
Senator Sands.
Here.
Representative Bassett.
Here.
Representative Cafaro.
Excused.
Representative Lenz.
Here.
Representative Pearson.
Aye.
Representative Welch.
Here.
And Representative Moore.
I'm here.
Thank you.
Okay, with that, thanks, Bon. With that, members, just a few housekeeping details as far as the future work of our committee. Obviously, the situation is pretty fluid right now in terms of rescheduling committee meetings, but so keep in touch with your emails and phone calls, and as soon as we get some stability in this situation, we will look to reschedule our lost days this time. It's my intention, if we have to do it by worst case, go to meetings or video conferences or whatever we have to do, but I'm committed to finishing up our committee's work in the interim because that is important, even though it may be dwarfed by the current crisis that we're in. But I'm determined to finish our committee's work by the time we reconvene in 21, and we will do that in as expeditious manner as possible. Going forward with this meeting, once we get to questions from the committee, conference calls are always tough because people are stepping on each other, but say your name with a question. We'll try to move forward as in an orderly fashion as possible when we get to questions from the department. During the department's presentation, and when you're not asking a question, it might be easier to keep your phones on mute. Seems like you always pick up some background noise when we get on these conference calls. And that is all I had. Ms. O'Connell?
Thank you, Mr. Chairman. Members of the committee, I just wanted to point out that while we're not taking public comment in person at this meeting, there was an opportunity for people to submit written comment. I did send comment to you from a couple of people, from Adrian Cotton on behalf of the Montana Area Agencies on Aging, and then from Beth Cavalier, whose name I may be mispronouncing, but both of them sent in some comments related to their concerns about the current situation with COVID-19. Mr. Chair.
Thank you, Ms. O'Connell. With that, I will turn over to Director Hogan. Director.
Good afternoon, everyone. Thanks to everyone on the line. This is, I've not seen anything like this in my lengthy career. But with that said, I just want to give you the lay of the land. And before I get started, I want to thank Todd Harwell and Dr. Greg Holzman and the Public Health Lab for all of the work they're doing on the ground. The Public Health Lab, Public Health, and then all the public health offices in your communities are really our boots on the ground. So as you know, you saw that the governor created an executive task force in direct response to COVID-19. General Matt Quinn is the chair. Brenda Nordland from Department of Labor, Tammy Rice from Department of Commerce, Allie Bovingdon as the Governor's Chief of Staff, and Tom Livers as the Budget Director, and myself sit on the task force. The purpose of the task force is to provide interagency and public communications regarding COVID-19, provide situational awareness as COVID-19 evolves, including preparedness and risk management, and to provide guidance and support to all of our partners across the state. The Executive Task Force provides executive leadership to the overall response to COVID-19. First, I would like to introduce Todd Harwell, who is the Public Health and Safety Division Administrator, and then Todd will turn it over to Dr. Greg Holzman. Todd.
Thanks, Sheila. I appreciate the nice comments too. So, Chairman Moore and committee members, good afternoon. Just a couple things. The agenda I'd like to just briefly go through with you today is a couple things. One is I'd just like to do kind of an update on at least in our world, the public health response and what's been happening in the state since actually early January when things started to boom in China. And then I'd ask Dr. Holzman to provide some information to you all, because I think you could be messengers back in your community too, because there's a lot of confusion out in the public about testing, and we are getting lots of volume calls related to that. So I felt like that was important to share with you. And that Sue O'Connell shared that infographic with you, and we'll kind of walk through that as well. So my comments are going to be brief, but first off, just one is, we're all in this together. Obviously, some of this I was talking to the choir, but number one is healthcare professionals, public health, and everybody needs to take care of themselves, their family, and their neighbors. And it's been pretty impressive about how the public health and the healthcare system, as well as the communities, have mobilized to address this virus. Since the beginning of January, we've been working with CDC and the local and tribal health departments to get ramped up to prepare for COVID-19. Just a little bit about who do we have and who's working on this here. At the State Health Department, we have over 40 staff working on the response. And as Sheila mentioned, it includes our communicable disease epidemiology team. Those are the folks who are working with your local and tribal health department staff. They provide support on investigations of potential cases and work diligently on trying to prevent additional spread of it. They also provide a lot of technical assistance to your health department folks and providers at the hospitals related to quarantine and isolation. And then we have a 24/7 response number that we get calls from providers as well as local health departments to address whatever issues are going on at that time. We also have a large team of staff in our public health emergency preparedness and hospital preparedness programs. They're really the team that prepares us for the bad day, and they provide logistics around our incident command of services. And we also provide funding to the counties and tribes for the preparedness staffing as well. So your counties and tribes have staff people in your health departments who are part of this response area effort as well for preparedness. And I'll talk a little bit more about the funding we just received from Congress, because that funding comes through the preparedness program. As Sheila mentioned and definitely gave kudos to, I wanted to also say thanks to our public health laboratory staff here at the state. We have a state lab, and I think a number of you have actually toured our lab. They provide and coordinate transport for specimens here in Montana. We have a courier service that goes across the state to pick up specimens for COVID-19, but also for many other different public health-related tests and diagnostic tests. Our lab staff have been working 24/7 plus to provide services to providers out in the communities. I'm sure you've probably seen this in the newspaper, but our lab has expanded courier service for pickups for 7 days a week, and we've also added 22 additional courier service pickup sites across the state so we can get specimens in as fast as possible. Montana also has 4 large reference labs that are out of state, but they provide services for Montana. I believe all 4 of those labs are also ramped up in providing testing. And then we have our private hospital labs across the state. They're a little bit behind somewhat in terms of their capacity for the number of tests they can perform, but they're ramping up to provide testing as well. And then the last thing for the state, for our area is, and Sheila has been, we appreciate your support on this. We've been pulling staff within our division from other areas to help support the response. And then Sheila has been super helpful with pulling staff from other areas across the department for non-essential services to help with particularly with our lab testing. You probably are all aware of this, but what is your local public health doing as part of this response? They've been mobilized since January as well, and the key roles that they play are they're working with the providers in the community to investigate potential cases and with the goal of preventing future spread. They're providing consultation to providers in the community about patients' risk and testing. With all the health officers that I've spoke to over the last 2 weeks, one main thing they're fielding is just doing public education and fielding many calls from the community and others about am I at risk and things like that. They're doing a lot of work coordinating with the hospitals and providers as well, particularly related to the hospital staff that we fund for preparedness. And then they're providing pretty much 24/7 consultation and TA to schools, daycares, and businesses. One thing I just want, go ahead. Oh, maybe they wouldn't say anything. One thing, too, I just wanted to share with you is how we coordinate and communicate with the health departments, so you are aware of that. So we have, in addition to our 24/7 call-in number for health departments and providers, we have a system called the Health Alert Network, and it's basically a mechanism that we can use to push out key news guidance and information, both to health departments as well as healthcare providers, healthcare professionals, and others. We push those messages out that we get both from the Centers for Disease Control as well as messages that we create here at the state. And those go out to the local health departments. They get pinged, and then they make decisions about distributing them to the local providers. So that's one mechanism we've been using quite a bit, multiple times per week, to get the latest information out. And I know you're all aware, but the situation with COVID-19, like the clinical recommendations, testing guidance, it's changing pretty much daily. So that's one way for us to communicate. We're having weekly conference calls with all the health departments to go through coordinating investigations as well as laboratory services and anything new that's happening. And then we've been working pretty diligently with other key partners like the Hospital Association and the hospitals, nursing homes, state facilities, and the MMA. We've had multiple conference calls and webinars over the last 2 weeks with those folks to provide technical assistance, but also to identify issues and identify solutions to those. Just a couple other areas I just want to mention that so you're aware of. I know you're all aware that there's an international shortage of PPE, or personal protective equipment. So we are working on a plan right now to start pushing out that type of equipment here in the next few days. The state has a limited supply or cache of PPE that we have on hand now, but we also just received our first larger shipment from the national stockpile. So this is a stockpile held by the Centers for Disease Control that includes everything from gowns, masks, gloves, N95 masks, as well as other materials. So that material will be coming out shortly from the department and pushed out across the state. The other area, too, I'm sure you're all aware, so Congress passed that emergency funding, I believe it was $8 billion in total to support the state's response. One category of that funding was for public health, and it comes from the Centers for Disease Control. So we've already received that money from the CDC. It's about $4.5 million, and it's of supplemental funding. And that funding is earmarked for a couple things. One is for funding. The funding will go out to local and tribal health departments to support their preparedness efforts. A large chunk of that money will go for that. Another portion will go for laboratory capacity here at the state, as well as supplies for testing. It will also, a large chunk of that funding will be used for purchasing additional PPE. And let's see. Yeah, and then a separate portion of the funding is for to support epidemiologic and surveillance activities. Last point I had was, the key to succeeding or addressing this epidemic is really, it's got to be all of us. Public health and healthcare professionals are a major part of it, but it's really the community and how the community responds to the guidance being put out by the Department of Health and CDC is making sure we're taking care of ourselves individually, we're following, the personal hygiene, as well as what we're doing here today, using an alternative mechanism to meet and creating some social distancing. So I think that's what's going to lead us to success. And then last thing, too, I'm sure you're all aware, but who are the vulnerable populations associated with this virus? Right now, it's mainly older individuals as well as individuals with certain kinds of chronic conditions such as immunosuppression and other chronic conditions. So we need to make sure we're cognizant of that and taking care of those individuals and making sure we're not putting them at risk. So I'm going to stop there, and then I'm just going to pass the baton to Dr. Holtzman to talk a little bit about testing for COVID and the system in place.
Thank you, Todd. Thank you, Representative Moore and the rest of the committee. I'm just going to go through a couple things. One, even just to show how things are changing very quickly, even high-risk factors that Todd just mentioned. I know there's new data out today, which I have not even had a chance to read yet, from the CDC, talking about some other populations. So I will have to take a look at that and get information to you. The other thing that I really want to get across is, we're really lucky to be in Montana for a lot of different reasons, but on this situation too. And as individuals are watching the national news and noticing the differences in response across the world and even across our country, it's not, especially in our country, it's not that one is doing things right, the other one is doing it wrong. It's that in Montana, we're still in the containment mode. We are trying very hard to prevent any large Montana outbreaks. We know the virus is here, but we don't want to see a lot of community spread. And as you look on the CDC website, you'll see that they have put up for communities, wide community spread, or community spread. I haven't even seen the exact wording on it. In Montana, it will say indeterminate, which means we still can try and will try our hardest to stay ahead of that curve. So a couple messages that we're really trying to get out to people is, first and foremost, to Montanans to remember that prevention is the treatment right here. So the social distancing and the number of other recommendations that have been said over and over again is what we as a whole community need to do to try to prevent further spread of this virus within the state of Montana. This is for two reasons. One, the longer we can keep it out, the better. And two, that helps us, as they say, flatten the curve, which means if everybody got sick at the same time, some of the things that are sadly happening in Italy, it overrides our healthcare system, and our healthcare system can't keep up and treat everyone. So people that might be able to then save may die. If we can flatten out the curve and keep it below the surge capacity of our healthcare system, that allows us to be able to care for and hopefully save many more people. So ideally, first, we don't want to get the virus at all. Two, if we do, we want to spread it out to bring that down that area. The last thing I wanted to mention is about testing, because I think it's caused probably the most confusion out there. And some of it's because the testing protocols have been changing as more information comes in and also where we are in the response. And this is, again, an example of where it might be very different in Seattle of what they're doing, where they already have community spread, versus in places like Montana. So really there's only two major reasons that we're testing right now that we would want to be testing for. Tests are happening much more than that, but two major reasons. One is, for example, in a hospital setting, somebody comes into the hospital, they want to test that person quickly and get that result back as quickly as possible, because That helps them know if they're dealing with COVID-19 or not for the patient per se, because the treatment is the same. It's supportive. We don't have an antiviral medication. We don't have them. But it helps the healthcare providers know what kind of personal protective equipment and stuff they need to do in the hospital, which helps us save those resources for when we need them. So that's one of the areas that it's really important that we keep up on the testing. The second aspect of where testing is really important is when we're trying to control the outbreak. So as we said, we don't see wide person-to-person spread in Montana now. So if we find cases and we can quickly work with their any close contacts and put them in quarantine, hopefully we can prevent the spread from going any further. Patients who are in quarantine who do not have any symptoms, they just had a very close contact with someone, those individuals, testing them to rule them out that they have the virus or not is not very helpful at this time, because what it will do is it tells that they're negative, but it doesn't mean that they won't convert. So they'll still be in quarantine for the full 14 days. So that's, kind of the process that we're looking at. Now, other people, there's a lot of other people that want to get tested, and we're not saying you shouldn't test them. People that are symptomatic or that someone that's symptomatic or something of that sort. The difference that we're saying is now with different places opening up, what we want to do is make sure those ones that we need quick turnaround on are getting quick turnaround. Right now, it's our state lab that can turn things around the quickest. Now that there's a lot of, there's more and more of the private sector coming up, doing those tests through them, or if it gets sent to us, we'll do them too, but we want to make sure that we get these prioritized ones done as quickly as possible. That testing is fine. It just might take longer to come back. We've heard anywhere from 3 to 7 days. And that shouldn't change the way the provider treats that individual. So if the patient is sick, but not sick enough to be in the hospital, that provider will send them home to be isolated. They should stay isolated in their house. They'll talk to them about how to keep other people safe within their household, and they should stay there until their symptoms. They should stay there definitely until we get a response back on the test, whether it's positive or negative. And if it's positive, then there's a whole other protocol on how long they stay there, which I won't go into now. So that needs to go right at the beginning. And by Montana state rules, providers are told that if they do a test, just even doing the test, they should notify local public health. That's not to get local public health to say yay or nay if you can do this. It's to let them know so they can get ahead of the game in case that test comes back positive. Because what we don't want to happen is it to come back 7 days positive and we found that this person has had many more contacts. So that local health is going to be trying to work hard on, you need to stay isolated until we have confirmed response back on that. So these are ways that we're trying to work on that two realms. One, the use of precious resources in our hospitals that are coming through private suppliers. A lot of them are coming through private suppliers. So, and we know that they're all trying to order things, but not everything is available right now. And then the second side is because we're still not at community spread, let's stay in front of it and see that we can keep this out of Montana. Now, I'll just end with this. Those testing guidelines could change depending on how the situation changes within Montana. So with that, I will end my comments. Thank you so much for your time.
And Director Hogan, this is Todd. I don't know if there's anything else you'd like to add, and you can.
I thank you, Greg and Todd, and Chairman Moore. We turn it back to you for questions.
Okay, thank you, Director. I'll start while everybody's getting their phones ready and getting their questions prepared. Mr. Harwell, you said earlier in your presentation that part of the distribution, the $4.5 million grant from CDC went to local health for preparatory efforts. What exactly would those entail? So it's from the local county health department.
Yeah, so that 4.5 million, a large portion of it is going to go out to county and tribal health departments, and it can be used for multiple purposes, for staffing time, for investigations, for bringing in additional support staff to support the response locally. It's really fairly flexible on how it can be used at the county for public health purposes.
Okay, thank you. Further questions from the committee?
Yeah, this is Mary McNally from Billings, and sort of a follow-up to Chairman's question, with the money going out to tribal and local health departments. Can you elaborate at all on how that's going to be distributed? Is it how it's going to be allocated on a per capita or flat sum and timing?
Representative McNally, I'll have to touch base with our staff on the allocation level, but I know we are going to push that out as soon as possible. We are amending adding an amendment to the current task orders for the counties and the tribes, and then we're expediting getting that out, getting it completed. Kind of like what CDC did the same thing. They did a super fast push to us to get the funding to the state. So we're working as fast as we can to get it out to the locals.
Thank you.
So, Senator McNally, we are looking at those allocations right now, and I would be glad to share that when those are ready.
Yeah, I'd appreciate that.
Sure.
Thank you, Director.
Mr. Chair, this is Senator Olszewski with a question.
Senator Olszewski.
Mr. Chair, Mr. Harwell, a couple questions on the testing. Number one, how's your supply of reagent? Are you getting it from the CDC or are you getting it from other labs? And also, is it coming in first to the state and then distributed to these other hospital labs, or are they competing with you through different other distributors trying to get their reagent?
Okay. Senator Olszewski, I'll even we're on the phone, I'll go back to the formal process. I forgot to do that. So, Mr. Chair, Senator Olszewski, so first question is we are getting regular shipments of the test kits from the Centers for Disease Control. Each test kit has 500 tests in it, and we've been regularly getting those, so that's going well. I don't believe your second question was, are we kind of competing with private labs in terms of testing kits or reagents? For testing kits, I do not believe we are. CDC has prioritized state labs to get those, and it's an evolving situation with the private labs because the FDA has changed or waived some licensing requirements. So many private laboratories are actually creating their own tests and bringing those up now. Mr. Chairman, Senator Olszewski, the one thing I'll just throw out, what are the other challenges and some of the solutions that have come up. So it's not, the test kits are one part of the equation. The other parts of the equation are the swabs to take the nasal samples. There are shortages of those. The second part of that equation is the viral media, so that when you get your nose swabbed for COVID or other influenza testing, viral media is the media in a tube that's used to keep the virus alive in the swab that gets shipped to the laboratory. So there are shortages of those, but because we have such smart laboratory people in the United States, they figured out alternative ways to transport those specimens using just saline. So that's something that's just come up this week. There are potential shortages of reagents and other parts of the components, but I think people are working 24/7 to help address those.
Thank you. Follow-up?
Go ahead.
The follow-up question is, Mr. Chair, Mr. Harwell, any additional protections that are required for our lab workers to deal with COVID-19? Or, because I already know that you use the highest degree of protection with all our other infectious diseases.
Mr. Chairman, Senator Olszewski, I might defer that question if I could to Dr. Holtzman.
Thank you. Please.
Sorry. Yeah, Mr. Chairman, Senator Olszewski, at this point in time, we are doing all that is recommended by the CDC as far as proper equipment used for our laboratorians to do the tests appropriately and safe for themselves. And we will continue to do that. I don't see any issues with shortage or that we're going to, at this point in time, have to look at any alternative guidance that might come out from the CDC if there is a shortage of certain protective equipment. But we have enough here for our employees that are actually doing the tests.
Thank you. Further questions from the committee?
Mr. Chairman.
Yes.
Mr. Chairman, I have a question. Representative Welch.
Go ahead.
And I think probably for Mr. Harwell, but he can pass it on if not. A lot of the stuff I read early and things we heard was that it was the elderly population. And I know a lot of that was driven by apparently the issue in the state of Washington with a rest home. But it appears to me that the cases that we've seen publicity on here in Montana have a whole range from 20 to 50, 60 years old. And I guess my question would be, are we going to see a spike in the elderly cases? In elderly, I'm thinking 65, 70, 75. And if so, if we anticipate that, are we doing anything special in the case of that age group?
Mr. Chairman, Representative Welch. So, okay, I'm going to defer that question to Dr. Holtzman. Thank you, Mr. Chair and Representative Welch. So, kind of going to the beginning, things that we're talking about, that we're in a different situation than Seattle at this time. We are doing many things that we've had I don't know what the word to use is, but we've learned from the other folks that are dealing with much severe symptoms right now to try to even prevent that from happening. So the closing of people visiting the nursing homes is one way to try to protect those individuals, that their employees that are going in and out are being screened very closely with certain protocols. These type of things and many more are what we're trying to do to prevent the virus from ever getting in there. Again, going with the idea that the prevention is the treatment right now. It's not as far as the virus itself, it's the worst outcomes. And much of this data is actually out of China originally from their cases, seem to be individuals that were older and individuals with underlying chronic diseases that they've mentioned. There's new data out that has been released today, and like I said, I have not gotten the chance to read any of it yet. Senator Olszewski might have. You might be ahead of me, Senator Olszewski. But is about some of the cases that are actually happening here in the United States. So this is so fluid because we're looking at the data as it's coming in and looking at the data between what's happening in China, what's happening in Italy, what's happening in South Korea, and knowing that there's different ways that they're responding to this, and also there's different abilities that they have within their healthcare system, and also their population makeup, like what percentage smoke, how old individuals are, those kind of things. So it's ever changing, but that's kind of where we are currently. Thank you.
Thank you.
Mr. Harwell, this is. Yeah, go ahead.
Go ahead. Fans here.
Go ahead. Go ahead, Senator.
Questions for, I don't know if it's for Sheila or whomever. Given, I think our biggest lockdown facilities are really within corrections, but as part of your department, we have the state hospital, and I don't know what other facilities we actually have and run. But do you want to talk about what are our preventive measures there? We certainly don't want this getting into the state hospital, which is one place we have people flowing in and out of at a pretty fast clip sometimes. Can you kind of address that issue? Thanks.
I can't. This is Sheila. I can, as best I can, maybe Dr. Harwell. We have restricted visitation, which will be a big help. We're also assessing employees as they come in every day for temperature, things like that. We are also, if employees have gone on vacation, travel, those kind of things, we have those discussions. And then we're also, we've done some training, and our facilities have been on calls with public health so that they know the best mitigation strategies for our facilities. And Dr. Holzman, is there anything you'd like to add?
Yeah, this is Todd. This is Dr. Harwell. Thank you, Sheila. I've got an upgrade there. The only thing I'd add is, yes, we've been on, our communicable disease team has been on multiple conference calls with our facilities, and we work with our facilities. We've worked with them for years on other communicable disease outbreak-related issues, so we're providing 24/7 support and guidance for them to help prevent those vulnerable populations in those facilities from getting infected, or their staff as well.
Thank you.
Mr. Harwell, you mentioned briefly in your presentation about the PPE issue, gowns, masks, those kinds of things. Who's sort of taken the lead on that? Is it the CDC and the federal government that's going to try to allocate the supply problem, or they delegate that to the states, or is it each individual private entity that needs to go out and find their own? How's that work?
Mr. Chairman, it's all of the above. So, but from our end, we get the CDC national stockpile. It's not just PPE; it's other medical supplies, depending on what the issue is. And so they push the stockpile out to us, and then we're in the process of pushing it out our facilities to the facilities across the state. But simultaneously, the hospital association works with all the hospitals to do both contract purchasing of PPE, medical supplies, and care. There's multiple players in this that are working on that issue.
Okay. Further questions from the committee?
Mr. Chairman, I guess a general question for the Parliament. Is there anything you specific need from the legislature that's not covered, say, by the governor's general authority that we need to be aware of or thinking of, other than providing kind of a conduit to our local institutions and the public as they contact us and referring them to the right place? And we really appreciate all you're doing. It's amazing. I'm very confident in what you're up to. But is there any other role that you see from us or that you need from us that we can do to help?
Thank you, Senator Sands. I ask that you have your constituents lean into their local public health departments. We also have, I didn't mention during my presentation, we have a call line, and we have people can email as well. So we've already had 700 calls and emails. So sometimes we'll just need someone to reach out to get accurate information. I'd be glad to provide those to you. The email, the website, COVID.
Excuse me, Sheila. Excuse me. This is Sue. You're cutting out a little bit. I don't know if you can speak closer to your phone or something, but we're having a little trouble getting your information.
All right. So COVID is the email, is the website, COVID. Can you hear me before is that better?
Yep.
Oh,
that's
yeah.
better, Sheila.
Okay. COVID, COVID-19.mt.gov. That's the website. I'm going to give you the email now. COVID-19 info@mt.gov. We also have a phone number that's manned, and if they get a message, they can leave a message, and we'll get back with them. It's 1-888-333-0461. And when I was down there yesterday morning, there was a nurse and an epidemiologist and other staff answering those calls. So let me give you that number one more time, 1-888-333-0461. And you can always call me, many of you do, and I'm okay with that, and I can write things down for you, and you can communicate with your constituents.
Thank you. And Chairman and Dr. Hucker, do you mind if I add a little bit on that?
Go ahead.
This is Dr. Holtzman. And understand the other thing that I would ask that would be very helpful, as you know, your local public health is working nonstop, and just to me are heroes out there. One thing that you could begin to do is help your community know that the local public health employees, when they reach out to somebody because they were a possible contact to a known case, they're not going to, if they're asymptomatic, they're not having any symptoms, they're going to not recommend them to get tested because the testing, if they get a negative test, it really doesn't mean much because they could convert the next day. They will be put into quarantine for 14 days, and that's to protect the spread, as we've all been discussing. But to keep reminding your constituents and everybody that this is a community response. And so if everybody does their job, we have a much better chance of being successful. And I will say on a side note, what I've seen so much happening in the communities has been really encouraging. I mean, it really has been neighbors helping neighbors, and that's been fantastic. But your continued messaging is also very helpful.
Mr. Chairman, can I follow up with Dr. Holtzman, please?
Follow
up on that, and this was raised by a couple of people to me in the last couple of days, given we're kind of at the end of spring break, both for our elementary and secondary schools and also university students. So we have all these people who've been everywhere else in the country and the world who are now arriving back in their home community. And I don't know if you all have thought or planned in asking them to self-isolate themselves for a period of time, or if they're getting any kind of information about how they should perhaps behave given they have been out in the other world.
Yes, Chairman, Senator Sands, thank you for that question. Yes, we have been working on that quite a bit, and there should be guidance, if it's not already been released, will be released soon. I thought it was going to go out earlier today, and it very well might have. But there is, for exactly that reason, many people are coming back in from different areas, and we have guidance out on that.
Thank you.
Chairman Moore, may I add? This is Sheila.
Go ahead, Director.
We're going to reach out to airlines. We're going to also ask airports to put a notice by baggage claims so that individuals who may not, if they're out of the country, they may not, I don't know how you couldn't know about this, but giving them some guidance on who they should reach out to when they get home, when they go home.
Okay. Further questions from the committee? Going once? Going twice? All right. Director, we'll let you and your staff get back to work. I'm sure you are very busy. We know you're. We want to thank you and please convey a gratitude to the rest of your staff, Director, for all they're doing for the state of Montana, and thank you for your time.
Thank you.
Thank you. Have a good day. Public health and safety.
Okay.
The meeting.
Sheila?
Ms. O'Connell, details work.
I'm sorry, Chairman Moore, I couldn't quite hear your question.
Yeah. So do you have some final housekeeping details for us before we wrap it up?
I guess if there was just any discussion you wanted to have about your future meeting dates, at this point we don't really know when we can meet again. I did want to just point out that you had a 2-day meeting that contained more time than would be available if you just had a 1-day meeting in May, as is currently scheduled. If we try to go to a 2-day meeting when we can meet again, there may be some conflicts with other interim committee meetings. So I think what I would suggest is that I just keep in contact with the staff here. We try to coordinate some dates, and then at some point we'll do a doodle poll with dates to see what would work best for the most members of the committee. And if there are any dates that any of you know for sure that you can't meet in April, May, or June, if you could send those on to me, I can at least mark them out on a calendar now, Mr. Chair.
Thanks, Stu. That would be my thought. I think the situation is too fluid to set any firm dates right now. We'll just end up having to move them. So let's see how it unveils. As Sue said, if anybody's got any dates where you have commitments, send them to her, and we will send out that poll that sees what dates everybody can make it as soon as we have a little bit better idea when we can get together again. Does that sound okay to everybody?
Sounds good.
Sounds good.
Yeah, that sounds good.
Great.
All right. Anything else?
Barbara Bassett?
We've left the meeting.
Okay. Unless there's anything else for the good of the order, I will call us adjourned. Thank you very much for your time.
Thanks.
Thank you.